Hey guys, it's Sandy here with Freedom Warrior Fitness. Welcome back to my channel. I've been MIA for the last few months trying to work on my rehab for this hip labral tear. So I am 4 months out from that labral tear, and I wanted to update you guys on what's been going on, what I can and can't do, and some things that you could probably expect. Everybody's different, but I'll share with you my story. So 4 months out, had a hip labral tear in my left hip, and basically the tire, I call it the tire, it's the ring around the socket area that helps your femur joint to move back and forth like this, and mine was like a ripped up tire. So they went in, they sunk 4 anchors in there, sutured it all down, cleaned up the debris, and sent me home. And so we're 4 months out. Spent the first 6 weeks non-weight bearing on crutches. The next 2 weeks partially weight bearing, walked a little bit around the house without my crutches. And now we're at the 4 month mark. And so I've been doing PT pretty much the whole time except for about the last 3 weeks or so. And that PT has consisted of a lot of core work, because you're going to find that when your hip goes out, most of the time your core is also pretty weak. And so mine was pretty weak, and so we've been really concentrating on trying to increase that core. 4 months now out, I'm going to say my core is still pretty weak. I'm finding that I think I might need to go to a pelvic floor therapist and get a little bit more information on what's going on with my core. But that is something as a female that would be a good idea for you to do. If you have been having hip trouble for a while, most of the time your core is going to be off balance. Your pelvic area could be off kilter. And so those are things that a pelvic floor therapist can tell you. I also had an SI problem. I still have an SI problem. I was really hoping a lot of that was going to be resolved with my hip. It's not. That's a little disconcerting, but I am hoping that when I can get my core under control, that's going to actually help to hold that SI in where it needs to go. I've been working on a lot of banded hip work for my glutes because they're also pretty weak from having this surgery. It's amazing. My whole bottom floor basically feels like it's falling apart. So I've had people ask me, would you do the surgery again? Probably not. I can't say that it was a failure because I'm only 4 months out. I really am trying to give myself a full year to see myself get back, into the swing of everything. My doc told me 3 months I'd be running. I'm nowhere near running. I can't even walk for more than half a mile without pain in the groin area, and also my hip flexor fatigues just crazy fast. I'm not really sure why that is. I have another appointment with my doc to discuss that and find out. So some things I can do, I can actually do some of my workouts. I can squat. I can do, I try to do a lot of one-legged RDLs, things like that. I actually can do a lot in the gym. Probably the biggest thing I can't do is walking, running, going uphill. Those kind of things hurt. I can ride the bike. The Airdyne is totally fine to ride. I can't lift very heavy weight right yet because my core floor is so weak. And so I'm really trying to be careful. I have a tendency to overdo things, and I don't want to do that. So I'm trying to be careful with that. Other things that I can't do, let me move the camera here for a second. I'm actually sitting in Indian style, but it is hurting a little bit. I don't typically sit like this because it hurts too much. Today I'm trying to stretch that joint out. I definitely have some piriformis tightness going on because I can't do the piriformis stretch yet. I'm trying. I get a lot of pain with that, so I'm doing my best to try to do that. So I do try to sit in this little Indian style for as long as I can tolerate it. Then I bring my knees up to me. So my suggestion to you guys, if you are looking at hip labral tear, really do your homework. If it is literally your last alternative, see if you can go to physical therapy first and see if there are things you can do to strengthen your core floor and your hips to see if that really helps. Maybe even change up your exercise program. If you're a runner, I don't guess that's necessarily an option for you because you're running all the time, so you might have to look into that. But I can definitely say that a hip labral tear, there's no guarantees that you're going to be back to normal. So far, I can't say that I'm back there yet. I was able to work out even when I was in a tremendous amount of pain. But I knew that if I continued like that I probably would end up with a hip replacement. And to be honest with you, sometimes I think a hip replacement would have been an easier recovery. But I know it has its own issues, so please don't send me hate mail about that. Anyhow, I would have to say that 4 months out, I'm okay. I can't say that I'm like, woohoo, let's go for the next, hip or anything like that. And I really was hoping I'd be further along at this point, but I'm not. So I'm really trying to embrace the process. I'm trying to work on all the other aspects that go along with your hip. So increasing my glute strength, doing a lot of banded work, significantly trying to increase my core strength, significantly trying to increase my patience because I don't have a lot of that when it comes to this. So that's been hard, and trying to stretch the amount of times that I need to in order to keep those areas from scar tissue building up, because that is something that can happen, is scar tissue can build up in there, and that makes it even harder. And then when you go to stretch, it literally feels like you're ripping something apart or you're trying to break something. I think I probably have a little bit of scar tissue because I haven't stretched as much as I should, so shame on me, but you can, because I'm telling you right here to do it. So that's my 4-month update. I was hoping that I would be like a total rock star by now and telling you that I was running hills and all kinds of stuff. Not happening. But like I said, I'm gonna give it a year. So I will update you guys again, probably in a couple months, right around the 6-month mark, see where I'm at. If you have any questions about a hip labral tear and about the surgery itself, you can go back to some of my previous videos. They're in there, and I do go over all the surgery and how to prep for it. What are some of my top 10 tips in order to get prepared for surgery and what you can do after surgery. But if you have questions, drop them down here. Give me a thumbs up, subscribe to the channel. I would love to have a chance to talk with you and share a little bit more with you personally about my journey and hear about yours. I'd love to hear how yours has gone. If you've had a hip labral tear surgery and your results have been different than mine, I would love to hear it. Let me hear what you're doing. Okay? All right, guys. I hope this has been helpful, and we'll check back in a couple months with you on the hip labral tear. In the meantime, get to the core work. All right? Warrior on.